Dr. Percy Marshall will be presenting strategic toolkits from professional sports to show that, yes, indeed, fast results are possible with conservative approaches. He's the head of the medical team of the first Bundesliga team, RB Leipzig, and a specialist in physical and rehabilitative medicine. He holds a master degrees in micronutrition therapy and regulatory medicine. Before he joined RB Leipzig in 2018, he was a co-founder of the Institute of Sports and Exercise Medicine at the University Medical Center Hamburg-Eppendorf and responsible for professionalizing sports medicine care for the HSV Youth Academy.
So, hello everyone. Thank you for inviting me to talk about possible approaches on conservative treatment in professional sports and sports injuries, and on how to deal with pain. A quick glance at my conflict of interests. I'm a medical advisor for Medical Motion and Autark Ventures, and lecturer for a couple of companies that do work with athletic training and supplementation. As for myself, I've already been introduced. I've been studying medicine in Hamburg, started working there as one of the team doctors for HSV, and was transferred 2018 to Leipzig, now in charge of the medical team there, and finished my studies in master's studies in physical and rehabilitative medicine, as well as in micronutrition therapy and regulatory medicine. So before I start my talk, I want to go into one very specific detail. So this is a quote that I usually give the audience when I'm talking about sports medicine and how we work. So this is about evidence-based medicine in sports medicine. And the question is whether this is a contradiction in terms, because much of the medicine practice that we have developed in this special field is primarily developed empirically and by clinicians. So if you look at the research that was done in the 90s, then you'll find that lots of the work that has been published scientifically is not highly published scientific work. So I want you to keep in mind that quite some of the things that I'll be showing you are things on how we work clinically and what has been proven by us in everyday work, what works best. But there's yet much research and science to do to really prove some of the things that I'll be showing you. But I will try my best to explain the science behind it and the hypothesis and the idea on why we treat our athletes the way we do and what this means to the general population. So let us start with this. So when you look at these pictures, at these 9 pictures, I would like to ask you what you see. You see pomegranate, you see pineapple, you see ginger, but what could this look like as well? So I like to compare it with this, because these different types of natural plants and ingredients have all a very similar way of how they, or what their effect is on humans. They are natural painkillers. They are so-called phytopharmaceuticals or nutraceuticals. The definition of phytopharmaceuticals are plant-derived compounds that have pharmacological activities. So basically, they are plant-derived medication. Nutraceuticals are pharmaceutical alternatives which offer or claim physiological benefits, like supplements. So with phytopharmaceuticals, we have natural medication, whereas nutraceuticals are a little weaker in their proof of how they work. But they all have the same idea. They are natural substances with less harming side effects, and therefore are more effective or better for long-term use in chronic patients. The idea is that we want to help the system instead of inhibiting certain systems. But I'll show and explain that to you later. There are certain anti-inflammatory and anti-edematous and analgesic compounds like bromelain, rutazoid, boswellia, turmeric or curcuma, and arnica that are already frequently being used and that I will go further into detail later on. Other nutraceuticals like creatine, vitamin D, and omega-3 have to be named as well, since they are supplements that have a very beneficial effect on pain and athletic, active people. So I would like to show you this really interesting work. It's a German work. It's an example of how you could alternatively treat degenerative, painful, and inflammatory processes in orthopedic medicine. So it's the dietary management of symptomatic osteoarthritis of the knee. And this group has really made an effort to develop a recipe including chondroitin, glucosamine, hyaluronic acid, different vitamins, different minerals like calcium, magnesium, selene, and on, omega-3 oil. And they have built this recipe and given this to patients with symptomatic painful osteoarthritis of the knee. And they developed this recipe with the idea of basically inhibiting certain processes like the development of radical oxygen species, the reduction of inflammation, the better development of collagen, the improvement of bone, and on and on. And now on the left side, you can see that basically the VROM, so 2/3 of the people that had taken the VROM did improve pain-wise, and only 1/3 did not improve. So this shows that even though they did not take any painkillers, that the effect on the degenerative and painful process was really positive. And this is where phytopharmaceuticals like systemic enzyme therapy with bromelain, trypsin, and rutazoid really get into effect as well. This obviously means that the doctor or the clinical person has to spend and invest much more time in the treatment of the patient, because you really have to think of the person that stands in front of you. But I'll show that this is really for the greater benefit of the patient. Now, why are we talking about this at all? So there's been really interesting work from a German researcher group, a group of journalists that looked on the incidence of energetic intake in professional sports. And they basically say ibuprofen was handed out like Smarties. And if you look at other different countries like the Premier League, Italy, Spain, American professional sports, you find proof of a real high incidence in intake. So the intake of painkillers really increases with performance levels. So we know from Canadian Olympians that the incidence is about 50%. Swedish Olympians it was shown that Swedish Olympians had a 6 to 10 times higher energetic consumption compared to the general population. The incidence in amateur athletic people in the United States was about 75%. 15% of those people admitted to have a daily intake of energetic products, whereas 1/3 already admitted to have a prophylactic supplementation. In the World Cup, we have an incidence that is above 50%, no matter whether they are female or male, and 1/3 said to be taken energetics for preventive reasons. And this is very similar to the numbers shown by the corrective studies that I've been telling you in the slide before. Over-the-counter drugs, NSAIDs, their intake starts quite often already during the teenage years without any medical supervision, often for prophylactic purposes. And this is independent of sports. Independent, you find the same numbers in soccer and field and track and runners in any kind of Olympian sports. Why do athletes need or think they need energetic products? Well, one thing is that athletes try to stay in team training. So they take medication and painkillers not to drop out, not to be harmed by injury-caused pain. Some of them want to stay focused on sports, so they want to block out any other problems like headaches, painful teeth, or anything like that. Some of them hope for a performance improvement when they supplement energetic agents. Others want to take it for prophylactic reasons to become stronger. Some want to stay competitive, and some just take it because of superstition. So you really can see that there are quite different reasons that really differ and that we have to think of if we want to teach our athletes and our patients about how to really behave differently. So what kind of pain do we have to deal with in competitive sports? So first of all, and most often, it is the so-called delayed onset muscle soreness, DOMS. We have to deal with bruises, we have to deal with muscle injuries, acute ligamentous injuries, chronic tendinopathies, fractures, stress fractures. Less often, we're talking about headaches, abdominal pain, and toothaches. And we have got something that I would call somewhat a hybrid pain. I call it the post-rehab pain. So we find athletes to complain about pain in areas where they develop scars, where the ligaments have built scar tissue, where the muscle or the muscle tendon junction, where they've developed scars. And these areas are more prone to painful hardening than non-injured areas. That's what I call the post-rehab pain, which can continue quite long, although the athlete is already fully training. Now, why do we care about painkillers at all? So this is a really nice review paper by Mr. Bindu from 2020, and it's about the side effects of chronic energetic agent intake of non-steroidal anti-inflammatory drugs, any kind of NSAIDs. So what we all think of when we think of side effects, it's any kind of gastrointestinal mucosal injury, so any kind of stomach bleeding and stomach pain, and renal injury. Probably one of the best known examples is the former German and Premier League player Ivan Klasnic, who has already had 3 transplantation of his kidney, who suffered from a chronic kidney failure after too much ingestions of NSAIDs. But I also want to go further into detail about these 2 aspects. One is the increasing intracerebral hemorrhage with an increasing risk for intracerebral microbleeding. Now, we continue to have a greater emphasis and focus on concussion and microbleedings and micro-injuries to the head of soccer players and many other athletes that have to deal with direct impacts. And knowing that athletes have a chronic intake of energetic agents, we definitely are talking about an increased risk for problem in this area as well. So if we are already talking and being concerned about concussion, we should also be concerned about the energetic intake, because both will affect themselves directly. But we are also talking about an increased risk of heart failure. So there might be one question on the increasing risk of a sudden heart attack, sudden heart effect, like we've seen it in the past, if there is a direct correlation to the intake or the chronic intake of energetic agents and NSAIDs. So there's no proof to this, but I just want to bring your focus to this, and I just want to bring this up. And this should be something that we'll be discussing in the near future. Now, what is relevant if we're talking about the energetic intake in professional athletes? So there is most likely an increased risk for sudden cardiac arrest. We have an increased risk for cerebral microbleedings. There is possibly an induced mitochondrial dysfunction, which will directly affect the athletic performance. The intake of energetic agents will mask the initial injury. So if a player will, under energetic intake, continue to train, the injury might worsen. We know that NSAIDs can slow fracture healing. It will alter the healing of grafts, like cruciate ligament. We have an increased risk of addiction due to the steady increase of dosage, which we can see especially in the American professional sports. We have an altered response to any kind of training stimulus due to a decreased protein biosynthesis and reduced secretion of testosterone, reduced collagen and ligament synthesis. So especially the last 3 things are something that I want to show you and I want to explain to you in more detail. So this graph, this figure shows you the physiological steps in the delayed muscle soreness, which is a typical sport-specific muscle pain. It basically causes micro-injuries in the muscular architecture, which induces the immigration of macrophages and somewhat inflammation process is being started, that is COX and PGE induced. These 2 molecules also induce the protein synthesis. In the further steps, we have a degradation and remodeling of the damaged cell structures and immigration of the stem cells and adaptation and supercompensation. But this shows that we need a certain amount of inflammation to start a protein biosynthesis. And you see that this is the reason why NSAIDs probably block this physiological effect. Now, if you look at this, this is an MRI image of DOMS. So this would, to someone not familiar to MRI pictures, already look like an injured muscle, an injured calf muscle. What exactly happens? So in sports, we want to have an anabolic process. So we have a training stimulus which induces an anabolic process by increasing hormones, the androgen receptor and local growth factors, which will increase the rate of protein biosynthesis under certain conditions like appropriate nutrition. And this will, if we have enough time to regenerate, increase our strength and muscle mass. On the other hand, if we have a catabolic process, so we have excessive training with incomplete regeneration, with stress, inadequate nutrition, or under the supplementation or the intake of painkillers, then we have an increase in catabolic hormones, we have a decrease in resting testosterone, and we have a decrease in the protein biosynthesis, which will eventually decrease the muscle mass and strength. Now, look at these MRI pictures again. On the right side, we have a clear, huge muscle tear. In the middle, you see also a muscle tear to the distal rectus femoris. And on the left side, you see a difference that is basically, especially in this area, you can see a diffuse enhancement in the muscle, which nearly looks like an injury, but it is a DOMS, a delayed onset muscle soreness. So you see that there is a gradient switch or a gradient transition phase of an injury to a DOMS. Or if you take it the other way around, you start with a DOMS, with an injury that can, if you don't treat it correctly, through wrong training, develop and become a muscle injury. Now, what happens if we take analgesic and anti-inflammatory drugs during training and or competition in young individuals? So this paper differentiates between the exercise performance, the acute adaptive response, and the long-term training response. So basically, during the exercise, after the exercise, and during permanent intake. And you can see basically any intake after the exercise or any kind of permanent intake will lead to a negative regulation of muscle mass, protein biosynthesis, or performance. There is a certain reason to say that under certain conditions like cycling in the heat, paracetamol is likely to help, but this is a very special condition. In general, we can summarize any kind of intake of energetic agents will inhibit athletic performance. Now, there is a relationship between the energetic intake amount and risks. So we know the more we take, the more side effects we have. And we know that there is a correlation between the intake and the duration. So we already have in the talks before, and there's been some talk about how the wound effect or the wound healing effect kicks into effect. What I want to go into just in quick detail is we have the so-called injury phase, which is the first 5 days in which we have the fresh acute injury, formation of hematoma and inflammatory response. This is the only phase in where we would sometimes advise to take analgesic agents if the athlete is in pain. The reparation phase and the remodeling phase, where we need the protein biosynthesis, is not the right time to take painkillers. Now, what should we do when we have an injured player? So the first 3 days, we have the acute management. So we're talking about the police protocol: protection, optimal load, ice, compression, elevation. In this time, those first 3 days, we're talking about light, pain-free movement and only light stretches. If necessary, the athlete is advised to use crutches and to avoid higher degrees of stretching. In this time, we can use manual therapy, lymph drainage, and any kind of kinesiotaping. In the post-acute management, so we're still talking about the first week, days 3 to 7. We're talking about active or passive assisted stretching, isometric exercises, sensomotoric training, and cardiovascular training without the loading of the injury site. So we really focus on allowing the injured side to start healing and not put too much strength or pressure on it. At the same time, we start the so-called emergency cascade in optimizing the healing. So we take care of the right nutrition, we give the athletes phytopharmaceuticals, we emphasize on physical therapy, reducing stress and optimizing sleep to have the optimized healing process. This is basically what it looks like. So we optimize on the energy level, on the sleeping level, on stress, and on the cellular response. There are additional alternative approaches that I will not go into detail, but it's percutaneous bioelectric current stimulation or certain different infiltration therapies. There are also, and I know that my colleagues will talk about this in more detail, different physical therapies that should be taken into account, like radio shockwave therapy, focused shockwave therapy, laser, deep warm therapy, or the superinductive systems. So these are different indications on when to use which physical therapy. Especially the radio shockwave therapy and laser therapy has great benefits on acute injuries. Now, let me once more summarize this. Any kind of NSAID in muscle injuries has probably no analgesic benefit, if at all, only in the first 3 days. It will inhibit the adaptation process because an appropriate inflammation is important for the regeneration. And that's why we're talking about nutraceuticals or phytopharmaceuticals, because those are natural inflammation modulators. Instead of inhibiting, they optimize the body's own response, like bromelain, curcuma, turmeric, boswellia, and different flavonoids or polyphenols. And this is basically what you can picture it. So instead of inhibiting it, the nutrient will give the cell or the system a better way of how to deal with the injury. And that's what we can use for DOMS as well. So this work from 2017 is showing on how systemic enzyme therapy can actually help us to deal with the pain of DOMS. And it shows that the constant and chronic intake of systemic enzymes will actually alter and lower biomarkers of inflammation and help metabolic and immune status. So we can see that these, instead of NSAIDs, which will actually not help us after 3 days at all, the nutraceuticals will probably help us faster to recover in strength and help us in overall responses. Now, what's the take-home message for conservative treatment of injuries and pain? So if you have an athlete who's injured, I would strongly advise you to immediately use the police protocol. I would advise you to use phytopharmaceuticals and implement a clear scheme on physical therapy. Additionally, work on a system to optimize the healing process. So focus on nutrition, sleep, and any kind of regeneration improvement. Have a look at micronutrition levels like vitamin D, omega-3, and uric acid. You can use topical enhancers to locally have a better healing process or pain reducing effect. If you use NSAIDs, try to use drug combinations to lower the concentrations and never take them longer than 5 days. So none of my players will take any kind of painkillers longer. If you have the need to give painkillers for a longer time, definitely switch to phytopharmaceuticals. Most of my players have bromelain supplementation, curcuma supplementation, or similar, and they really have no side effects, and it really helps them to deal with their issues after longer injuries. So I want to end my talk about the conservative approaches in healing. I hope this has helped you to get a better insight, and feel free to contact me or ask your questions after my talk. I'm more than happy to answer all your questions. I can provide you with all the research papers that I have, or scientific work that I have named. Either you ask me directly or mail me later on. Thank you very much. Have a great day.